Okay, so I'm going to move on to talk a little bit about practice assessments and what we're doing in the practice area. So you've sort of been hearing about some new emerging things, and this is something that is actually not so new at the college. We have been involved for the last couple of years in a transition in terms of our practice assessments and what that looks like. So I want to share with you a little bit of our learning and a little bit of what we're still working on and where we have yet to go. So pharmacy practice is evolving. Let me just go back to that for a minute. Practice is evolving. I don't probably have to say very much about this. People can see along the bottom here. The profession has been moving. Pharmacists have been moving from focus on dispensing right through to being decision makers and those clinical experts. Pharmacy technicians, many of you in the room here, we have you in place now in order to help that transition for the whole profession. So that has been an ongoing process, and that's what society needs. Our healthcare system is changing. Our patient population is changing. The sustainability of the system is at risk. And what we know is we need everybody working at the top end of their scope of practice in order to serve patient needs. So that's been an ongoing process for some time. What hasn't changed is that patients have always been at the core of that. And as you heard from Nancy, patients have been at the core of what the college has to be focused on, and we know that patients are at the core of what you do. So that hasn't changed as things have been evolving around practice. What we recognized at the college, though, is as much as patients haven't changed, the expectations of the standard of care and what those patients need in order to meet their needs, their patient needs, perhaps hasn't been as clear as it could be. So a couple of years ago, the college made some shifts in how we do things, recognizing that it was really important to be clearer about what those expectations are. What are the standards that will help you to achieve that common goal that we have of serving patient needs? And that's where I want to share with you what we have been doing, what we have observed, and where we see further opportunity in our efforts together. The practice assessments. If you're a community pharmacist, there's a good chance that you have some familiarity with this. I would hope so, and there's a good chance that there's several people in the room who've already engaged in this process. Over the last couple of years, we've actually completed 6,000 community pharmacist assessments. That's the group we're starting with. So if you're not a community pharmacist, a pharmacy technician, know that we are actively working on the development of these assessments for that group next, as well as hospital practice, so pharmacy technicians in hospital and pharmacists in hospital. This is something that's coming to you soon as well. But we have done this now for a couple of years, 6,000 people. And what we're doing is going in now and looking, observing. You know that we have a long history of coming into pharmacies, and we recognize that during that time we could be working with the people in the pharmacy, observing practice as it's occurring, and making clear what are those expectations. Sharing that information and assessing whether or not people are practicing to the standard that we need. So we've been able to engage more people, and in that sense, we feel that we also have been able to work with pharmacists to continually improve practice as we're doing that. So what does it look like? Don't worry if you can't see the details on this slide. Again, I'm not going to spend a lot of time on it. What I really want you to sort of notice is there's a very small slice of red. There's a big middle section that's circled there that's a light green. And there's a darker green at the end. And I want you to kind of think of it as an arrow that is moving across to that darker green. I'm going to explain it a little bit more on the next couple of slides. That's really just keep that in mind a little bit. It's just a very little bit of red, and there's a big group in the middle. Another slide that again, doesn't matter if you can't see the numbers on here. This slide is representing everybody that was on that first slide except for that red slice. So the people on red, which was a small number, it was under 3% on the other slide, those are the people who, in those observations, have not been practicing fully to the standard that we need them to be practicing. No different than our previous QA program. That's kind of the pattern we've seen, and we work with those individuals to make sure that we bring them back to the standard that the public needs. Everybody else is at the standard and is here. So everything you see here, people are practicing to standard, but to varying degrees. The highest quality, true quality improvement we want to get to is that top corner. There's a number there that says 177. That's that dark green that you saw in the first slide. That's optimal practice. Those are the people when we go into the pharmacy, they're there. Everything, we have 13 indicators, you'll see that in a moment. Everything that we're observing for those 13 indicators, those people are doing it. They know what it is, and they're doing it. Everybody else is doing it, but in many cases, they need further clarification. They do need to understand what that standard is, what the expectation is, how do they demonstrate it, or they need some coaching to get there. And with that, they also are meeting that same standard. But ideally, we'd like to be able to see everybody just knowing what it is and doing that across the board for 13 indicators. So for us, this is great data because we can start to see the numbers shift. And ideally, we want everyone in that top quadrant. This is 2017 data that you're seeing on this slide. And the good news is 2/3 of the pharmacists we've seen this year are in that top upper quadrant, and only 1/3 are in the lower quadrant, which is suggesting that they sort of if there's 13 indicators, they're struggling to show it on more than half of the indicators. They're sort of struggling in being able to show it. And we want people, as I said, getting to the place where all 13, they know what it is. So here are the 13, and they're grouped into four main categories: patient assessment, decision-making, documentation, and communication and education. When you look at this slide, again, you don't need to see the details, but you can see where the opportunity is. Very clearly, we have some areas, communication and education. People really are focused on that. They do a good job doing that. They know what the expectation is around that. And that probably reflects to some of the fact that the college has, for a long time, focused on that and made it very clear what that is. So it's a good example of the collaboration where if we can be clear about the standard and the expectation, you can clearly get there. We've got some work to do in other areas, documentation for sure. Recognizing that that's not just about knowing what the expectation is, which has changed more recently, but also recognizing there are other factors that do contribute to documentation, systems and things that need to come into place to support that. So it's not a surprise to us that we see what we do there. Patient assessment, not bad, but certainly opportunity to move that up. And likewise, a little bit more opportunity with decision-making. That's that clinical judgment, being the clinician that we need you to be. That's using your pharmacy technicians to the full extent that they can offer support so that you can provide your clinical expertise. So that's what we have been doing. As I said, it's going to be something that is pushing out to more people. Again, I want to focus on the resources and the fact that this is quality improvement. It's no different than quality improvement with medication errors. We need to keep driving our practice to something that is even better than where we are right now. So that's what we're trying to do. We provide a coaching model to do that. We provide resources. So again, you've got it on your table, a page that shows you many of the resources that the college has available. Oh, okay. I just want to say before I go on to this, actually, I'm way behind on my slides here. In terms of some of that coaching then, just you have community practice advisors that are coming into your pharmacies. They are one of the huge resources that you have available to you. They're learning from you. They're learning from that group of optimal practitioners what are good practices, what are great ways to do things, and they're able to take that from place to place and share that. That's part of that coaching model and the QA. So I do just want to point out, because that's not one of the things you'll find on the website. You'll find that person right in your pharmacy when they come to meet with you. They're a great resource, so make sure you use them. So practice assessments isn't everything that we know is going to get us to where we need to be. Scope of practice, as I said, sustainability of the system is important, and that scope of practice that everybody, technicians and pharmacists, are practicing there is what we need in order to truly contribute fully from a pharmacy perspective. So the college has recognized this and also been working on putting a strategy together, which you probably have also seen come out. This came out in the spring. There will be more information as we continue to evolve this strategy. But it is a recognition that there are some things that we need to do to have pharmacists, pharmacy technicians together, collaborating and providing the kind of practice optimally that makes pharmacy contribute to the healthcare system to the extent that's needed. So again, I'm not going to get into the details. There will be much more of this coming out over a period of time. You can take a look on the website and see a little bit more. It was in a previous Pharmacy Connection. But just recognizing the key bullets. Engagement of the profession. We need everybody fully engaged, fully confident that they can be engaged and contribute to the system to the extent possible. That goes for both groups of practitioners. People need to feel that they really understand their role and contribution to be made. In order to do that, we have some work to do. We need to help you, and we need you to help us define what are the best practice models. What does optimal practice look like? How is it that pharmacy contributes the most to the healthcare system, to the outcome of patients? We need to try and understand what that is. We're going to be looking for practices, understanding what are the things that help make that happen, what are the barriers to that, and how do we help grow that then across the province. And finally, data. You've heard a lot about data tonight. We know we need more data. We need to use data. We need to understand how to look for indicators that, again, will help us to be informed and will help you to be informed on how to achieve some of these activities. So we'll be looking for indicators and tracking over time so that we really can identify what are those optimal practices and then how do we grow them. So, takeaway messages. As you can see here, we're really asking you to embrace your role. Embrace your role and your goal to serve patients and to use the knowledge that you have to do that. We're also wanting you to, I guess, use that and use it in an optimal way is really what we're talking about there. I'll try to grab this other piece of paper without shutting this off. I also want to point out to you on your table you have a summary of our code of ethics. So the note up here about being a benefit and focusing on the benefit of your services to the patient is one of the key components of our code of ethics. So it really is a reminder that it's not just about serving and not harming and safety. It's about making sure that you're optimizing the services that you're providing to your patients. That's what they need you to do as well, and that's part of the code of ethics. And finally, we're just asking you to engage. Engage with us, back to where Nancy started. We know we have a common goal. We need to work together. As much as our responsibility is to the public and the safety of the public, we know that's what you want as well. And the way we'll achieve it is to work together, and we're here to help you to do that.